Okay, good morning, Professor Ngowi.
Good morning, Blaise. How are you?
Very fine, thank you. I hope you are doing well too.
I'm doing well, keeping social distance.
Yes, very important these days. Thank you
Sure.
for being with us today. We wanted to take a bit of your time to give us a brief update on the situation here. But before we go into this, maybe we can have a brief introduction about yourself.
Yes, yeah, my name's Honest Prosper Ngowi. I'm professor of economics at Mzumbe University, and I'm based in Dar es Salaam, where I'm heading the Mzumbe University Dar es Salaam campus as the principal of the college. But in the context of SWISSAID, I sit in the local advisory board, and I've been around for some 2 years, I think, in my capacity as an economist.
Absolutely. Thank you very much for this introduction. And indeed, we've been working together for now quite a bit of time. So we would like to have your assessment on the situation in Tanzania with regard to the outbreak of the coronavirus.
Yes. Now, situation in terms of numbers, really the numbers are relatively low compared to the global figures that we are seeing from US, China, Saudi Arabia, Italy, even some numbers from neighboring countries like Kenya. And but now this is it on the in terms of numbers. I won't talk a lot because this I think belongs mainly in the mandate of the Minister of Health. But now the situation is its impact. And its impact on the economy, I think that is where I have my expertise. Because of the nature of the COVID-19, what we are seeing are actual negative implications on the economy, broadly speaking, across all sectors. We are seeing, for example, there has been a lot of disruption in the travel industry, in the aviation industry. We are seeing tourism really declining because of of the pandemic, the travel bans from across the world, but also in Tanzania now, there is now this quarantine for 14 days, at someone's cost. Really, this reduces, the number of those who might be willing to travel to Tanzania. But we are also seeing disruption in the supply chain. As I've said, key transport sectors are affected, aviation, for example. Again, this affects things like movement of horticultural crops, for example, from Tanzania to, for example, the Netherlands, flowers, vegetables from places like Arusha. We are seeing decline in the tourism industry and tourism value chain, number of tourists really going down. And this affects a lot of hotels and other related sectors. Once hotels are affected, it means also taxi drivers at the airport are also distracted. Farmers who we are supplying their produce, let's say vegetables and fruits to these hotels, they also lose, incomes. We are seeing again institutions have been closed. I'm a professor. I'm an associate professor of economics at Mzumbe University. Universities, secondary schools, primary schools have been closed. What is the implication? All those that we are gaining income from students, there's institutions being open, they have lost income, so rather these incomes are going to be postponed. Universities, for example, no school, and even colleges and secondary schools, no one is paying school fees. So these institutions are losing fees. Those other people who are doing business like catering and other businesses around universities, around secondary schools, around primary schools, they have also really lost income. So really the situation isn't so good, it's bad.
Thank you very much for these insights. And maybe you mentioned a little bit the farmers. Maybe we could have some more insight on the smallholder farmers and the small-scale miners with whom we work a lot through our program here in Tanzania. What could be the impact on their day-to-day life?
Yeah, let me start with the smallholder farmers. We have our farmers, for example, in Masasi, in Mtwara, but also, of course, across elsewhere. These have been producing for, especially, maybe not so much in Masasi, but then smallholder farmers in northern part of the country, Arumeru, Arusha, Kilimanjaro, for example, they have been producing for tourist hotels. I'm not sure the situation in our farmers in Masasi, But the thing is, so long as they were producing for hotels to supply to hotels, and these hotels really have seen down the, down, have been going down in terms of guests. Really, they also it means that they cannot purchase so many vegetables and fruits, for example. I have been in a hotel in Morogoro for 2 days, actually, since Monday. Was it Monday? Yes, since Monday. It's a hotel with 35 rooms, and I've been the only guest for all these 3 days, really. You can imagine, So out of 35 rooms, it's only my only one room that was occupied. No meals that are cooked there, actually, and even if they'll cook meal, it's for myself. So you can imagine the suppliers. I can think those who are supplying vegetables, those who are supplying meat, fish, eggs, for example. Really, they are losing incomes, and this is much wider when we consider smallholder farmers supplying to, there's large tourist hotel in Dar es Salaam. I know, without naming names, I know quite a number of tourist hotels that have closed. We are seeing universities have closed. And these universities have been fed by smallholder farmers in terms of vegetables, in terms of fruits, in terms of chicken, beef, in terms of, all kind of agro supplies. It means really they are losing incomes. But also this thing has disrupted the supply of seeds and supply of some, imported farm inputs, for example. I'm in talk with the Agricultural Council of Tanzania. I'm in talk with TAHA, Tanzania Horticultural Association of Tanzania. I understand that some stakeholders had to import some farm inputs due to disruption in the supply chain. They are unable to get those things in time. They have produced whatever they've been producing. Some would be exporting their vegetables maybe to the Netherlands. And I had just a video this morning from a supermarket in Netherlands, where really we see flowers, we see vegetables being thrown away because there is no demand. We have seen the US where milk is being poured down because, there is no demand. So really, although it starts somewhere at the corner of the world, it affects smallholder farmers here in Tanzania as well. For miners, for example, I've seen a small report showing COVID-19 has also affected miners. I was in Arusha maybe 2 months ago when Corona was not so much a big issue. I visited the international mineral market at the center of Arusha. It was really full of life. Now I'm told it is really calm. Why? You could see part of these big buyers have been foreigners. There have been guys from China, guys from Thailand, etc. But also, even if they're only local, the government is actually advising, to use a better word, to avoid the large crowd. Now, if you have been at the international mineral market in Arusha, and I've been there, I've also been in Mererani, really, it's a lot of people meeting together. Now, with all these bans, there is no lockdown yet, but then with this discouragement of huge crowds of people meeting, really people don't attend those markets, and it has implication on sales volumes, on sales revenue, on profit, but also on production, because if no sales, no one will be producing. If no one is producing, no one will be employing. So people will be losing jobs. When they lose jobs, they'll lose also incomes, and livelihood really goes down.
Thank you very much for this insight. We can really see that this is a global crisis with a lot of repercussion on many different sectors in different ways. Maybe a quick question also from a gender perspective. Are there specific issues for women and in those sectors of mining and farming, which, to what extent can they also be hit harder with this crisis?
Yeah, looking at the nature of agriculture in Tanzania, agriculture is mainly really, of course, small scale, but it's mainly women who are mainly engaged in agriculture in Tanzania. And so immediately there is loss of income in the agricultural sector. Really, women become the first to suffer, because really they are the ones who are earning a lot of, who are working a lot in farms. They are the ones who are doing vegetables, for example. They are the ones in the marketplaces who will be selling, those agro products. So long as there isn't selling, really, they suffer. But also, when there is loss of incomes at household level, whether it is the man who has lost a job, for example, in the aviation industry, the transport industry, in the hotel industry, in the mining industry. There is now reduction of income at homes. Now, who are the what you call the caretakers at home? These are women. So really, it is the woman who would struggle mainly in African context, in Tanzanian context, to make sure that there is food on the table. So it might be a man who is losing jobs, but really it is mainly the woman who will be bearing a huge part of the, of the burden. We might see sick people, and God forbid, and Tanzania, maybe we don't have so many sick people out of Corona, but then when there is sickness in a family, in African context, it is normally the woman who would carry the burden. She will take care of the kids, she will take care of the husband, she will take care of the her relatives and the relatives of the husband. This is the situation in Tanzania. So I'm likely to see, and this is unfortunate, women might be more negatively impacted by this. We are seeing loss of jobs, we'll be seeing reduction of jobs, and those who are going to lose jobs are those mainly in the lower cadre in organizations. People with the casual laborers, they pay, people who do not have so many skills. Unfortunately, when I'm looking at the labor statistics in our country, women are likely to suffer more.
Thank you very much for these very insightful views on the situation. Maybe a last question would be, what would be your recommendation on certain steps that can be, or measures that can be taken at various levels?
Mm-hmm. Well, my recommendation really has been, there are recommendations at the level where we are now. You could see Tanzania has not reached really the critical point. We are yet to flatten the curve. So when the crisis, when the pandemic is still really picking up, I think we have done quite a lot of efforts, and I think it should continue education, sensitization on what the disease is all about, how it spreads, and how to protect ourselves. And there's been a lot of effort in terms of sanitation, and I'm happy that I think it is working. I was at the middle of nowhere in a village in Morogoro. You see people cleaning their hands, and I think that's very clear. But now there is a need of what I call policy interventions to make sure that we cope with the situation now, but also we cope with the situation post-COVID-19, because I'm sure it's going to go after a while. It could take some months, some weeks, maybe even a year or so, but one day it will be over. Now, if we do not have a proper policy response now, the COVID-19 pandemic will be over, but the economy will be disrupted. So we need to have a lot of what I call fiscal policy measures and monetary policy measures now, in order first to rescue the economy now, but also to help it recover when the pandemic is over. On the fiscal policy, let the authorities help in terms of what I call expansionary fiscal policy. Reduce taxes, reduce number of taxes, reduce tax rates, give tax incentives, give tax amnesty, give, and it should be actually now what you're seeing in Kenya, for example, value-added tax has gone down from 16% to 14%. Tanzania is still 18%. This is a bit high. People who are on the front line, our medics, for example, elsewhere in other countries, I think Nigeria, Ghana, they have got a tax waiver out of their salaries because, of course, they are more at risk, But we also expect or recommend what we call a subsidy. Government to subsidize really some of the expenses related to fighting corona. It's not everybody who can buy a sanitizer. I bought sanitizer at Dar es Salaam in a supermarket. I think 10 meals. I paid 10,000 shillings. Day later, I had to pay 20,000. I have a family of 5, so I have to part with the 20, almost 100,000. I can afford. Really, I can afford. But I know quite a number of people who cannot afford. It's not everybody who can afford the mask. It's not everybody who can afford the soap. We take so much for granted. It's not even everybody who can afford even water. It's not everybody who can afford, vitamin C, because we are recommended vitamin C, oranges and stuff. So subsidy in this area in terms of government shouldering part of the burden, it could help. But on the monetary policy, I would propose what I call expansionary monetary policy, where the government really makes sure that there are reductions of on interest rates. Those who have to pay to the banks can have a little bit of postponement in paying their loans without having to pay penalties, for example. Government have to ensure through a Bank of Tanzania that there is more money in circulation, because really we need to stimulate the economy so that we offer some recovery. And you can see in Tanzania now it's time for budget. So the budgetary sessions in Dodoma should factor in the COVID-19 thing, because when we got the budget proposal for 2020-21, that was December 2019. COVID thing was not in town yet. Now this new kid is in town. It should alter really the way we discuss our budget. These are extraordinary times, and in extraordinary times, we should take extraordinary measures.
Thank you very much. I think that's for sharing your thoughts and your expertise on these very important matters. Indeed, we are in extraordinary time, and we need to find extraordinary solution to address these. Thank you very much, Professor Ngowi. It's been a pleasure, and I wish you a very safe trip. I know you're on the road back to Dar es Salaam.
Yeah, I'm from Morogoro, Mzumbe University, Morogoro to Mzumbe University, Dar es Salaam.
Wonderful. Thank you so much. Have a safe trip.
Goodbye.
Bye-bye.
Bye-bye.